Do you think this is actually a correct notion, that we have so much so left the men out of the conversation of gender issues?
The word, according to me, the word is not leaving men behind.
Okay.
Because leaving them to what or versus what? Because for a long time we know, and this one is being driven by data.
Right.
Every program that is being implemented, there has to be a background research that is being done so that you can say we're implementing project A because we've seen numbers, both narrative and even qualitative and quantitative, reading these and these. So I feel it's not them being left, but redefining the level of engagement. The role of men and boys, either as husbands, fathers, partners, community and religious leaders, needs to be defined according to a particular context. So the conversation that I feel has not been there is us looking at what is the level of engagement and how do we bring them in, whether as partners, whether as fathers, whether as community and religious leaders. So I feel the conversation should gear towards how do we bring them on table to ensure that these vices are being reduced, because the most important thing is for these numbers to go low, as low as 0. And to ensure that women and girls are healthy and they can achieve their potential just like men and boys can achieve their potential. So meaning both men and women needs to be at the table and have conversation. So the level of engaging them is what I feel really matters, and engaging them in terms of health in that space, engaging them as decision maker. As we know, the National Assembly and the Senate House has men being majority. They're the ones who make policies, right? So if we can engage them at that level of them being men and them being policy makers, then we get to achieve better policies for women. So I feel we really need to define how we really engage them. But I feel they're not being left behind. They've been already in front in so many things in terms of education, and they're still there.